Just got done putting a chin implant in somebody, so I thought I would grab Fred the head here and we can talk a little bit more about chin implants. This is Fred, if you guys haven't met him before. He's a little fragile because I dropped him a couple weeks ago and he fell apart. But we have a few different options for augmenting the chin. On the lesser invasive end, some patients will opt to get a little bit of filler right through here to improve the anterior projection of the chin. Kind of middle invasiveness would be to put a small chin implant in. These are typically made of silicone. We'll talk about these in a little bit. And then on the most maxillary invasive end, you can have orthognathic surgery with a mandibular advancement, where an oral surgeon will make a cut in the bone right here and actually pull your own jaw forward. Chin implants are nice because it's a fairly straightforward procedure and it's definitive. It's meant to be a permanent device. These are meant to live with you forever. They don't have to be exchanged like breast implants because they're solid silicone. There's no risk of rupture like that of breast implants. So there's two ways to put these in. One is transoral and one is submental. Typically prefer this way for two reasons. One is that there is a lower risk of infection because we're not dragging a foreign body through your mouth. And two is a lot of my patients end up having a concurrent neck procedure at the same time as their chin implant. So then it's just one incision and I can do both procedures, neck and chin implant through that. These are flexible so that we can make a small incision and wiggle it in. They are tapered on the end so that once you're all healed, you really can't feel the transition point between the implant and your native bone. They're also trimmable, so we can cut these or mold these or shape these in the operating room to better fit. Let's say I like the projection of this implant, but I don't feel like we need the full width. I may trim off the tapered end of it to be more customized to you. A few unique risks to these chin implants. So since they're a foreign body, they could move. We have the goal of having it sit right over the bone here in a tiny little pocket so that our risk of movement is decreased. Over time, it finds its little home there and should never move. The other risk unique to putting in an implant is infection. It could be that if a tiny little microbe gets on this, whether when it's from your skin during surgery, even though we do it sterilely in the operating room, there's a slightly higher risk. If it moves or gets infected, we have to sit down and kind of assess the situation. We can always take these out if we need to, which is kind of a bummer. But pretty straightforward. If you need a chin implant taken out, you just open the incision and then just grab it and slip it right out. Some surgeons will affix these to the bone with a screw. I don't like to do that. I don't think it's needed, and that would increase the risk of a nerve and or dental injury because your tooth roots come down here. And there are some important nerves that live right on the side of the bone that we do not want to make mad. You could have a little bit of paresthesia or weakness in the feeling or sensation in this area if this nerve right here gets traumatized by a screw or me putting the implant in. Procedure itself is usually about an hour long or so, done with sedation, so you are not awake during the procedure. I find that most procedures of the face are more enjoyable. It's more of a pleasant experience for patients if you're asleep. And then you go home, come back tomorrow, we take a look at everything, make sure your pain's controlled. Swelling and bruising are fairly minimal as compared with like deep neck work. This tends to be a much more straightforward procedure in terms of swelling, bruising, recovery. And then in a few weeks, a lot of the swelling is gone and we're able to see, pretty much your final result.